Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today we're going to address the upper eyelid. So the skin around the eyes in general is thinner than on the rest of your body and the rest of your face, certainly. And so a lot of times patients notice earlier drooping, earlier sagging, more wrinkle formation around the eyes first than other parts of the face. And so to address that, we have various different options. And just talking about the upper eyelid, we have procedures that are completely non-invasive to minimally invasive, and then on the surgical side. And we are seeing patients even in their sometimes late 20s, but certainly in the 30s, starting to ask for procedures that will help rejuvenate their eyes. So depending on whether actually the level of severity of the laxity or the wrinkles, and then also the approach that one wishes to take, we can definitely custom tailor different procedures either in conjunction or individually to get you the best results. Currently, of course, a lot of patients are asking for a blepharoplasty, which is a surgical procedure, and in that we take out a precise amount of skin, a little bit of the muscle tissue as well, and then remove some of the bulging fat. And this really gives a very instant rejuvenation. Usually the recovery time is somewhere around a week to potentially a month, depending upon how much swelling a patient has and how quickly they're able to recover. The incision is very small. It's literally in the crease of the eyelid and not really visible at all. And it is a procedure that can even be repeated in the future quite easily if one needed to have it repeated. So it's a procedure that you can have even at a younger age and then perhaps redo in the future if you needed to. And then we have procedures such as thermage, which are completely non-invasive and also thermi smooth. These use a monopolar radio frequency energy that delivers heat under the skin and forces the connective tissue to shrink without having to remove it. And then we have procedures such as Morpheus 8 or Morpheus Prime, where we're basically using a needle that injects that radio frequency directly under the skin, again at a very precise depth that also causes contraction of that tissue. We also have procedures such as Accutite. If somebody has a greater amount of laxity, we can actually put the radio frequency probe directly under the skin to shrink it. Some of these procedures that are more on the minimally invasive side are still going to have some recovery time, but no incision. So it just depends on how much recovery time you have, how much of a difference you really want to see, and how to get you to the best place, either in combination, also keeping in mind your budget. So these are all things that require discussion to see what's going to be the best approach for you, but all very safe procedures and done here in the office under either local numbing or no numbing at all. Some have no pain, others might have a little bit of temporary discomfort, and for others you would be completely numbed and not feel anything. So nothing to be scared about, and awesome procedures that can really help you just look more rejuvenated. Thank you so much for watching.